Thank you, Mr. Chair. Thank you, Paul, for that global overview. And I want to thank PPD for partnering with APHRC over a long period on issues relating to population and development in Africa. For those of us who don't know, APHRC is an African Population and Health Research Center. We are headquartered in Nairobi, but we are a Pan-African research organization looking at issues about population, health, education across the Sub-Saharan Africa region. And we do three major things. One is research on, like I said, population, education, on health systems as well. We also do capacity building for research in Africa. We partner with universities. We give grants to Africans doing PhD in different African universities. We do workshops. And the third arm of our work is on policy engagement and communication, because after all the research, you need to engage with policymakers with this evidence and challenge them as the opportunity arrives. And I think that is part of our role in this meeting. To share with you some of the research, most of you already know, but to highlight some policy moments within those, to see how we can use some of this evidence to address some of the things that are affecting the countries where we work. And in my outline, I will look at some basic definitions. I will give you a background of why we think it's important to focus on youth. I give you a profile on adolescent sexual and reproductive health and rights in Sub-Saharan Africa, shares with you some context, some diverse situations within the region, because it is not really a one model fits all. Africa is quite not a country, it's a continent with so many cultural and socioeconomic and religious compositions. I will go ahead and discuss some of the other issues there and give some concluding remarks. So let me quickly go to basic definitions. And I think this is important because sometimes even when we talk about adolescents, somehow what the meaning is hazy. And so we thought we should just start with looking at the different definitions of people within this age group. And the first there is the concept child, which is under 18, which is actually a 1989 Convention on the Rights of the Child. And it's interesting to notice that in many developed countries, and actually in some other countries that are developing, you don't get a driving license until you reach age 18. Okay? You don't vote until you reach age 18. Okay? And if you are under 18, you are a child. But it's interesting that in many South countries, and it has come up many times in this meeting, our people, young kids, people who are children, by this definition, are getting married, they are having children, they are not, children should be in school, but our children are not in school. When you talk about sexual partners, you have high level of age asymmetry, where young children are having sexual relationship with those who should be their fathers and grandfathers. And in many cultures, this is allowed. And I think this is, for me, where for us to start. I think it is important for South nations to arise to this challenge. Okay, the fact that our children should be allowed to go to school. They should be allowed to not to get married. And these issues have been on the table for a long time. There's a lot of rules about them, but it is still an issue. As I go through, you will see the age asymmetry between sexual partners in many African countries, the age at first marriage, the age at first sex, and so on. So I think this is actually why we thought it's important to begin to these definitions. Adolescents 10 to 19, it's a WHO definition, youth 15 to 24, and of course you can divide that into two, older youths, which is say 20 to 24, and then younger ones. Teenagers, it's an American word, but it's also now globally applicable. Young people, okay, but for me, the important thing is the point I've already made. These are supposed to be children. and policy makers, and that's what we are. We need to get back to this basic definition, to give our children the opportunity to develop, the opportunity to mature, and if I look at the presentation you made, to mature physically, to mature psychologically, to be able to go to school and so on. So these definitions for me remain very, very vital. Why youth? And some of these statistics have also been presented here. Young people less than 25 represent about 50% of the world population. And interestingly, 90% of them live in developing countries, which is called the South-South. In Sub-Saharan Africa, the proportion of under 25-year-old is about 60% in most countries. Though generally a healthy period of life, youth also marks the period of initiation of risky behaviors. You know, it's a period of introduction to the world, and what we have found out by research is that whatever starts at this point has a lot of implications over the life course. Okay? If you start having kids before age 13, that will affect all the possibilities before you. At the end of the day, that will determine your future. There's not going to be any magic. Okay? So, this therefore becomes a very important period to focus on. And also, from evidence, there is least gain in sexual and reproductive health among this age group in many South-South countries. And yet, the primary cause of poor health in this group are largely preventable. If we enforce our laws that no girl gets married until 18, they will all graduate from high school. They will have better opportunities. Okay? Unwanted pregnancy and all that may not happen because we have focused them. And in many countries, there is a lot of laws about, I will get to that. In Kenya, there's a whole issue about, older people, having affairs with very young people. And that has jeopardized their future for a long time. In terms of global youth population, this is just a map showing us where the youths are in the world. And you can see Sub-Saharan Africa has a lot of concentration of that, where over 30% of the population are youth. How important is adolescent sexual and reproductive health rights in Africa? The timing of sexual debut is highly associated with STIs and HIV/AIDS. It's associated with contraceptive use. It's associated with pregnancy and pregnancy complications. In developing countries, estimated 60% of all adolescent pregnancies and births are unintended. Early pregnancy is linked to clandestine and unsafe abortion, and we use that word deliberately because these kids, and in many of these countries, abortion is illegal. So it is always a backyard business, but it is also a life-involving business. So quite clandestine is always unsafe. It also compromises young women's health and adds to the maternal mortality burdens. Early parenthood interrupts schooling, leading to fewer job opportunities, lower income, and ubiquitous poverty. Part of the vicious cycle of poverty starts from youth. And how important is SRH going forward? Millions of young people contract STD annually, and that is a risk factor for infertility and HIV infection. And like some of the presentations here, HIV has become a disease of young people, with 50% of all new global HIV infections among those under 25. And in many developing countries, up to 60% of new infections are among 15 to 24-year-olds. And on a rough estimate, there is female infection to male rate infection is at least 2 to 1. And in some countries, it is more than 2 to 1, like Paul has shown. They are sexually active, but the patterns are various. High percentage of women aged 15 to 19 have had intercourse. And that ranges from 73% in Liberia to 32% in Botswana. But you notice that, for instance, if you look at Liberia, you also understand their circumstances in terms of the civil war and so on. Okay, so these countries are different, and that needs to be underscored. Most of these relationships are premarital, as I mentioned earlier, and it's also differentiated by gender. In Kenya, for instance, median age at first marriage for women is 18.8 years, while the median age for intercourse is 16.8. So you see a 2-year difference. 4% of Kenyan men are married by age 18, but 64% report sexual intercourse before that age. So there is a lot of gender difference there. There's also the issue of coerced sexual initiation for girls and also for boys. And it is important to underscore also for boys. Boys may be perpetrators, but they may also be as well victims. Young men vulnerable to sexual coercion, harassment, and being rented as prostitutes are reported in Southern African mines, Nigeria, and Cameroon. And we have all those research. We didn't do them, but they're all out in literature. Schoolboys are responsible for most of schoolgirls' pregnancies in Kenya. And I think these things are important. Policy need to be context specific. Okay. Orphans are more vulnerable due to lack of social and economic support. Vulnerable groups. Adolescent transactional sex is common, and this is fueled by economic disadvantage. And the figures are there. We did a study in Kisumu, Kenya, and almost 70% of all premarital relationships young women has ever had, in those relationships, 70% of them, they receive transfers from male partners. And when you receive transfer from a male partner, your negotiating power is done. So you just say yes to end what you've been given. And so these are contexts we want to underscore as we look at SRH in Africa. Again, I think this has come up earlier on, but marriage and early birth remain key challenge we need to tackle. It's still common. The mean age of brides is 15 years in Niger, 16.5 years in Cameroon, and 17.5 years in Burkina Faso. All these are where children are getting married. The mean age difference between husband and wife is 15 years in Cameroon, and I think we need to take note of that, and 7 years in Kenya. Of course, the issue of the role of cultural, economic, and social factors. In Senegal, 4% of adolescent women and 7% of adolescent men have never visited a family planning clinic. The reasons are by the right, and they're all cultural. I'm not married. Okay? Gender imbalance in sexual decision making also influences these outcomes. Young men begin sexual activity earlier and have more sexual partners than women. This is also another gender dimension. FGM is practiced in 28 countries in Africa and performed between infancy to age 16. Doctors estimate that 10 to 30% of girls in the Sudan die from FGM-related complications. Of course, following SRH, following ICPD, a lot of countries have formulated a lot of policies. A lot of youth-friendly programs have been developed in many countries, but time will not permit us to go into all that. And that is also known to most of us. However, in kind of putting together what we saw as key responses, STI and HIV counseling and testing remains vital. Counseling and treatment related to sexual coercion and violence, also we think by our judgment of the literature and what is on the ground, remains crucial. Contraceptive services and supplies. Prenatal and delivery care by trained medical personnel to prevent avoidable complications and deaths. Increased investment in the quality and infrastructure of sexual and reproductive health services throughout the region. In the process of preparing this, I went through a lot of documents, and we can look at some of the research priorities also defined by WHO. There are also some policy action recommendations by WHO. I won't have time to get into all that. But let me quickly underscore the last point before, as I round up. And that is that urban context is important. I had the participant from Canada talk about rural areas, and I saw a lot of response in the session before. But our study in Africa have shown us that in many circumstances, the indicators, health indicators for the urban poor, not the urban rich, the urban poor, actually worse than a lot of rural places. Okay, there is this high rate of urbanization, and there is this high rate of slumization. In Kenya, there is a debate because the UN Habitat said 60% of that city are slums. Okay, the Kenya National Bureau of Statistics contested that, but the last census, they reported 33% of the city of Nairobi as slums. If you go by the official definition, that means a city of 3 million, at least 1 million are living in slums. And these are real slums. No public service and nothing. And in that circumstances, a lot of things breed. So as APHRC, we've been working on urban slums and urban poor. And we think it is important for this audience to take note of that within urban areas, there are people who are very near, but really very far, in terms of access to resources, access to opportunities. Kenya is practicing having free education program in the last 5 years. You may be surprised that 60% of kids who live in Nairobi, the capital city, have no access to those schools because they are living in slums, and there are no formal schools in slums because those places are informal settlements, so you can't even put schools there. Okay? So it is important for us to take note of that urban context. What we have done, in my conclusion, is that we have articulated with our partners a call for action to focus on the urban context. To focus on the urban context. And 3 areas, and I will be done. The support of high quality research. There is no alternative to it. 2, support for the development of policies that are focused. And finally, support to develop and sustain implementation of programs. So in conclusion, unprotected adolescent sexual activity is linked to Sub-Saharan Africa's rapid population growth, high birth rates, and escalating rates of HIV. Promoting contraceptives use among youths can lead to decreased morbidity and mortality due to unsafe abortion, unsafe pregnancy, and STDs. And this can slow population growth and give us opportunity to invest on the people we have. Number is good because it creates market, but it's actually human capital that is developed that is the real thing. Many governments and NGOs are working to meet adolescent SRH needs by providing sexuality education and development of life skills. But more need to be accomplished, and I think that is the bottom line. And in this circumstance, from our work and from what I said we are developing a call, which some of you will actually have opportunity to discuss tomorrow, we insist and believe that the urban context matters, and it matters a whole lot. In conclusion, the successful achievement by 2015 or beyond of many of the MDGs will require that policymakers center their attention on young people. Thank you.